What is central post-stroke pain after a stroke? Imagine waking up one day after a stroke and feeling a strange, persistent pain in the same part of your body that was affected. This is what central post-stroke pain is. It is a long-lasting type of nerve pain that can develop after a stroke, usually within the first few months. This pain isn't like a typical injury or muscle ache. Instead, it's caused by damage to the brain's pain and sensory pathways. When a stroke damages parts of the brain involved in processing pain signals, such as the thalamus or the spinothalamic tract, it can cause the brain to misinterpret signals. This disruption makes normal sensations feel painful or abnormal. People with this condition often describe the pain as burning, hot, cold, tingling, or stabbing. Sometimes even light touch or gentle pressure can trigger intense pain, a phenomenon called allodynia. This can make everyday activities difficult and affect a person's quality of life. Central post-stroke pain results from damage to the central nervous system, which includes the brain and spinal cord. When these pathways are injured, the brain receives faulty signals about pain or temperature. Instead of feeling normal sensations, the brain perceives pain or abnormal sensations. This can happen because of lesions or damage to specific areas of the brain that handle sensory information. The severity and type of pain can vary widely among individuals. Most often, this pain appears within 3 to 6 months after a stroke, but it can sometimes show up immediately or even much later. The chances of developing this pain depend on factors like the severity of the stroke, the location of the brain damage, and whether sensory pathways are involved. Younger people and those with more severe strokes may have a higher risk, but it can affect anyone. Diagnosing central post-stroke pain involves careful medical history and neurological exams. Doctors look for signs of sensory abnormalities and rule out other causes of pain, such as musculoskeletal issues or spasticity. Imaging tests like magnetic resonance imaging can help identify the brain areas affected, but there are no specific lab tests for this condition. Treating central post-stroke pain can be challenging. It often requires a team of healthcare providers working together. Medications such as certain antidepressants, anticonvulsants, and sometimes opioids may help reduce the pain, but responses vary from person to person. Non-drug options like nerve stimulation techniques or psychological support can also be beneficial. The goal is to manage symptoms and improve quality of life during recovery and long-term management. In summary, central post-stroke pain is a complex condition caused by brain damage from a stroke that affects how pain signals are processed. It leads to persistent, often severe pain in the affected body area. Proper diagnosis and a personalized, multidisciplinary approach are essential for managing this condition effectively. If you or someone you know experiences ongoing pain after a stroke, it's important to consult healthcare professionals who can develop an appropriate treatment plan tailored to individual needs.